Welcome to Beyond the Medical Algorithm, a podcast by the Philly Wellness Center. Join us on a journey through the too often neglected path to wellness, where we celebrate the human body and all things natural to illuminate new roads to health and happiness. Holistic is the name of the game, and I'll be talking to fellow experts and enthusiasts to rejoice in healing and revolutionize the way we approach therapy. I'm your host, Catie Harris. Hey, everybody. In today's episode of Beyond the Medical Algorithm, we're joined by Dr. John Oertle, a leading figure in the field of naturopathic medicine. Dr. Oertle is the Chief Medical Officer at Envita Medical Center, specializing in chronic infectious diseases, immunotherapy, and precision oncology. With a robust background in psychology and medical bioethics, Dr. Oertle brings a unique and holistic approach to cancer treatment and chronic conditions. His work integrates cutting-edge genetic and epigenetic analyses to tailor treatments specifically to each patient's unique needs. Today, Dr. Oertle will share his insights on using naturopathic medicine to enhance conventional cancer care, focusing on breast cancer treatment. So join us as we delve into a discussion of the powerful intersection of traditional and holistic medicine with one of the field's most innovative leaders. Welcome, Dr. Oertle.
Catie, pleasure to be able to be on today.
Yeah, I'm really excited to talk to you because this is the stuff that I just love talking about. I can't get enough of it. And we all need to hear what's out there because what we know isn't exactly working. So I'm very excited to hear your take on this. So maybe you can start and tell us a little bit about what drew you into naturopathic medicine and especially around the area of oncology.
Well, the reason for my becoming a doctor in the first place, I was actually diagnosed with type 1 diabetes back when I was 10 years old as a juvenile, got thrown into the medical system. And I loved learning about my body and being able to learn how metabolically, how it all functions. And so really deep diving, even as a 10-year-old, to be able to learn with my pediatric endocrinologists were just, again, exciting. And I actually really appreciated learning more about who I was and how I was made and how my body worked together in the foods. And so from that point on, wanted to be able to become a doctor and be able to go into medicine. But when I was in college, I ended up having to leave my pediatric endocrinologist where we were focused on prevention and just the whole dynamics of looking at why my body works the way that it does and how to be able to be best I could. And I had to go switch my doctors and go to an adult endocrinologist. And I'm literally sitting in the actual lobby of this adult endocrinologist as a young college student, healthy as all could get out. And I'm literally sitting there and I'm having people walking by me who are blind, having amputations that are literally being let out by their loved ones and caregivers. And I'm packed like sardines in this lobby. And I go back to be able to see the doc, and it's actually not the doc, it's the PA that I'm seeing. And they're literally like, well, John, you're doing great. You're healthy. I love your numbers. Everything's looking great. So I'm like, well, that's great. Anything else that you can do? They're like, well, the doc's going to be coming on in. Why don't you talk to the doc about that? Anyways, a little bit longer. Finally, the doc comes on in. Talk to the doc. He's like, John, you're doing great. Keep up the good work. I go, well, doc, what can I do? What else can I do? What is the best diet, the recommendations? How can I actually make sure that I'm healthy and that I stay well? And he brings out his script pad and he goes, well, you're doing great already. He gives me a script pad and he writes for lisinopril, which is a blood pressure lowering medication. And he goes, this has been studied to be able to actually protect your kidneys going forward. I said, well, doc, I don't have high blood pressure. He goes, yeah, I know that. But this is what I'm going to give you to be able to make sure your kidneys stay healthy going forward. I said, okay, hold on. I walked out of the office. I took the script. I never filled the actual lisinopril. And it really was this understanding that if this was the best I had was a pharmaceutical medication that actually causes cough, can actually reduce high blood pressure, but I didn't have high blood pressure and it's going to protect my kidneys. There had to be a better option because I didn't want to just have another medication that's going to cause this. Lo and behold, I was able to actually connect with my good friend and somebody that I knew who was in naturopathic medicine doing really innovative care at Envita Medical Center. And this is where I'm at today, who he said, get on in, we got to be able to do this. And we talked for hours at a mutual friend's birthday party right after this event. And I came on in and I was a patient of Envita, learned even more about naturopathic medicine and integrative medicine and how you can actually use the best of technology to be able to actually make sure that you're working with your body and not against it to be able to stay healthy and the data's out there. And so that's what got me into naturopathic medicine. I ended up going to school, learning, and then that was years ago. And grateful to report that I opened my eyes to the going into integrative medicine to be able to understand how to be able to work with the body instead of against it, or just giving a one size fits all approach to disease.
Yeah, I love that because I always hated this idea that somehow the body was confused or didn't know what it was doing and we had to fix it, because that doesn't make any sense to me. Like, there's something that we're doing to the body that's causing it to react that way. It's not doing anything wrong. So, and the more pharmaceuticals we add, it just seems to compound the problem until you don't even know what the problem is. Everything, you have a result in this place, but you've displaced something over here, and it gets very confusing very fast.
Well, I think you're right. One of these things I always like to share is that medications are not the problem. They're just a tool of how to be able to use it. But if we're coming from a standpoint of not looking at being able to use our tools in line with technology about how our bodies are working, our symptoms are going, oftentimes it's just they're being blindly prescribed that this is the protocol. This is what you have to go on, because statistically is being said, instead of looking at people as individuals and being able to make sure the right tool is being used for the right job. This is where, again, a lot of harm can actually be done to people and you don't have good outcomes. But I'm not against medicine. I'm not against medications. Just I want to make sure that they're being used to be able to be doing the thing that they're designed to do, to work with the body, not against it. And there's so many other tools at the disposal: diet, lifestyle, nutrients, herbs, and they can be synergistically helpful when used in combinations.
Yeah. And your endocrinologist probably would have gotten, I don't know, dinged or in trouble if he didn't give you lisinopril, right? Because it's part of the algorithm and that becomes very dangerous. And I understand why we have algorithms. We want to keep some standards and that kind of stuff. But once you veer, or maybe the algorithm's not right, maybe it's wrong, and having that ability to pivot from it is very difficult for conventional medicine.
Well, the system is not built for that right now. This is what I've come to, is that the system is not built to have the utilization of the technology around your individual genetics, the diagnostics, everything that's happening. It's built upon almost a one size fits all model. But I love that the body is not just this simple machine. It is a complex organism that has so many complexities and so many biomarkers that you just give one thing, it oftentimes leads to side effects. And then instead of actually taking a step back and saying, okay, hold on, instead of this simple machine where you just have this and then this triggers this which is what we've come to with a lot of our medical complex today. And this is what your insurance company is going to cover. And this is what you have to do, because this is what the board tells you that you have to do. And yet you have a patient sitting in front of you that actually doesn't work like everybody else, that's got individual unique characteristics about this disease process or how they're metabolizing medications. And when that's going on, if you don't pay attention to this and you don't have a system that's devised around personalized precision medicine, especially when you have severe consequences as a result of the disease process. There's huge side effects, or you have an autoimmune condition that has, again, huge, awful issues if you don't treat it. And at the same time, the medication is saying, well, you're at risk for tuberculosis and death and cancer if you actually go on these medications to treat this one disease. It's like, okay, there's got to be a better option. What's the actual root causes? How can we actually make sure that we're using technology that exists to personalize treatment and being able to actually treat these diseases, looking at root causes, making sure that we're working with the body, if that makes sense?
Yeah, absolutely. And I feel like it's kind of a lost art. It seems like that was something that was done in medicine many, many moons ago, and not so much at this point for whatever reason. So why don't you give us a little bit about how did you end up in oncology or breast cancer in particular?
I do want to recognize breast cancer because October is Breast Cancer Awareness Month. And so it's a really important topic. A little more about oncology. So I got into oncology because this was really a space where, when I graduated and then I came to work at Envita Medical Center, this is where we started. And Dr. Prado started in oncology. This is the friend that was talking to when he helped me and educated me as far as this goes. And Dr. Prado started in Envita Medical Center treating oncology and a really severe chronic disease. Specifically, we do a lot of investigations for infections, Lyme disease, but again, people that are dealing with autoimmune and neurodegenerative conditions where they're not finding answers anywhere else. And we're going to be able to look at those diagnostics to really put forth a good plan based upon what they have. But oncology was a big part of it. Dr. Prados had passed away, and it was a big part of being able to make sure that there's a better plan for him. Envita Medical Center, let me just talk a little about what we are. I mean, we're a large system where we are in Scottsdale, Arizona, and we do Center of Excellence, which is essentially people are flying in from across the country and 20% from around the world to be able to actually receive this precision level of cancer care. And when you look at oncology as a really good aspect of this one size fits all model that has gone awry in people's lives, this isn't just a let me deal with some side effects for the next couple of weeks as a result of going on the wrong med to be able to treat my, you name it, acute condition. There are people whose lives are being threatened as a result of not having options, or they're failing the options, or their lives are being shortened because they're not getting the best technology and what we've been able to actually develop available. And so I give this example that many times when you look at Envita, we're a precision oncology center where we have these individualized treatments available instead of something where if you have a stage 4 breast cancer, let me say 100 years ago, when you had cancer, it was not differentiated. It was just you had cancer. There was no thought about, okay, yes, you have cancer, it's a concern, but there was no different in treatment options. Then you got to the place where researchers and doctors started thinking, well, okay, if you are able to differentiate, maybe breast cancer is maybe better treated a different way than, say, for instance, lung cancer, or differentiated a little different than you treat prostate cancer. Well, then you're going to get a little bit better of outcomes. Again, these outcomes continue to be able to improve. But what we've seen is that every individual's cancer, with the more the genetic testing, the genetic options, the proteomic options, the testing that goes on in the actual world of oncology, the more you test, the more you see that each individual cancer patient is unique and different because of what caused it, what genomics are at play, what is the immune system, and why is the immune system not functioning well? How is the actual gut health, the toxin, the infection that's producing this cancer? And so literally, again, when you're left, I say that now, say, for instance, you're colorectal cancer, and they've differentiated breast cancer a little bit with estrogen receptor positive or HER2 positive. But even this is a minimal amount of testing to differentiate cancers versus all the thousands of biomarkers that Envita runs and that's available to then personalize that treatment plan around you as a person. So what people are faced with oncology these days, because the insurance companies, this is what a doctor is going to want to prescribe what an insurance company is going to pay. So part of this is a part of this problem of oncology and what we face. I'll talk to you a little about more of the solutions that we've developed around that. But this is where what goes on is that if you have a stage 4 colorectal cancer patient, you're really left with just, again, your first line therapy nationwide for oncologists, where we actually have found that when you actually are running you want to make sure that it's a precision treatment. 90% of our patients that come into Envita, their cancer is already resistant to the chemotherapies that are on label that are for them. 90%, meaning that if you give that chemotherapy the standard care model gives, you're seeing that it's not going to kill the cancer because the cancer's already resistant to it, going to cause side effects and harm. And a lot of those chemotherapies are causing harm to the immune system. And so in the gut, so you're not absorbing nutrients, it causes chemo brain and a lot of side effects. So what you want to do is we say, again, I don't want just a one size fits all model. I actually want to say I use the data. I love data. I'm a big geek when it comes to all the data that goes on in the world of oncology, but you want to implement that national population statistics and then correlate that with the individual plan. So if a cancer patient that comes to see us, we don't want to just give a drug that's already showing resistance, that's already going to cause more harm and not actually show evidence of treating the disease. Why would we give it? There's no reason to want to give it unless the only reason to give it is because the insurance company is saying that's the only option for you that it's going to have coverage for. And so this is where we're at with a lot of oncology patients today, is this one size fits all model, instead of saying, let's do testing to be able to actually evaluate your genetics, evaluate the actual reasons and the biomarkers, thousands of biomarkers, to say what's the best way to be able to treat this disease.
Wow. Yeah, that's really refreshing because when you read the news and you look at cancer survival rates, they haven't actually gotten any better, at 80 years and billions of dollars. And it's like we haven't made any progress.
Well, you hear you either cut it out, you radiate it, or you give chemotherapy and systemic chemotherapy at best. I'll give another example to you as far as this goes. Chemotherapy, when you are injecting chemotherapy, and this is not even genetically targeting, say these are targets, maybe the targets are absolutely good to be able to treat the cancer, but you're giving an IV, which you're not even having the absorptibility if you're given oral medication. Okay. If you give an IV and 100% of it gets into the bloodstream, I ask you how much actually gets to the tumor. And in the data, it's about 5 to 7% actually get to the tumor. So you also have to say, yes, you need to be able to make sure that there are good genetic targets, but then are those chemotherapies or medications getting to the tumor? And majority, again, 5 to 7%, that's why you need to give such high doses of chemotherapy that it feels like if you're on those doses of chemotherapy, oftentimes patients, if they stay on it, the reason that you have to wait so long is because it's going to kill you if you give it sooner. It's going to kill you. And many times, oncology patients are going into the hospital as a result of side effects and the issues that occur because of such high doses of chemo. In Envita, we've been able to actually use lower doses because we pair it, even when you have a systemic or an IV chemo, we've been able to pair it with other agents to help the effectiveness or the absorption to the tumors. That's very exciting. We have a whole process where we're able to actually directly inject under guided imaging genetically targeted chemotherapy and immunotherapies directly to the tumor. Guess how much gets absorbed to the tumor when you go directly to the tumor?
Oh, well, I'm sure it's more than 5%. Yeah.
95 to 100%. So what we've done is we say again, and this is where it's so important that when you see the results that we do, it's being creative to be able to actually use these reasons why. And we've been doing this for over 20 years, developing these processes and protocols. But yes, just that you want the right medications is just the tip of the iceberg. The next thing is you want to be able to make sure it's being delivered and appropriately delivered, which is what we've been doing with a high level for a long time here at Envita.
That's really frustrating in so many ways. Like, why is this not the standard of care? I mean, the technology's there, the medicine's there, the experience is there.
The results are there. So it is one of these dynamics as well. I mean, we look at this and we've been evaluating this and we've continued to grow. It's a beautiful thing. We've really grown at Envita being cash pay. We've been doing this in a cash pay model for the last, again, close to 25 years now. But it's great when you have a patient that's able to actually advocate for themselves and say, yes, I want this. This makes sense. This is good. And I'm going to go outside of that insurance-based model that's still in the dark ages of being able to get the best treatment. But where we started going to is when we actually ran our actuarial data back in 2020 of looking at this white glove experience for our patients, being able to make sure the outcomes are there and this way that we're seeing. And it's not just outcomes, it's also the whole experience of nurse to patient ratio. And it's a stressful situation to be able to go through cancer. And so when people fly into Envita, it really is being able to support them in with a warm greeting and a warm smile. It goes a long way. Answering their questions, being able to have this relationship with patients. What that's doing, it's even on a medical side. I tell all my team, lower the cortisol levels for the patients. The treatment starts when they walk in the building to make sure they know that they don't have to be stressed or anxious. And it doesn't have to be this white coat syndrome that they're actually looking and walking in feeling all anxious, but it becomes a very strong relationship that are built to be able to actually lower cortisol. Because guess what? That's going to help improve immunity. It helps stop fluid retention and starts to be able to actually help the body. So this stress component, even though that begins to be able to support you right as you walk in. But we did this level of actuarial data, and we actually found that our treatment was half the cost of the standard of care protocols nationwide. Half the cost of oncology, and you get this white glove experience and the increase. We thought, oh, this is awesome. This is so great. We're going to go and we're going to look at these other large insurance companies to be able to see is there actually any interest in being able to add us on to these plans. And there was no interest. And so that's when we started looking at how do we actually go into, because it's the system. Such a strong structure. I call it the medical insurance complex. And we've been acting outside of that very, very well for the last 20 years. And then when you left with trying to be able to implement this in, what we started working with is starting working with employers ever since 2020 to be able to actually work and grow. Because guess what? Employers actually want their employees to be healthy and they want reduced cost. And this is what you start to be able to experience when you have Envita as a center of excellence for employers. So we're working with employers and expanding the employer self-funded plans to actually include the Envita Center of Excellence to be able to make sure that they have this available in their plans. And so that's been really exciting for us to be able to actually make it available, not just for cash pay patients to be able to fly in, which they can, and it's effective for this. And we keep our costs, trying to keep them as low as possible to make sure that our patients are able to afford it. But when you actually have your health insurance plans through employers actually covering the work that we're doing, now it becomes such a joy to me to be able to actually say, yes, this is actually available to you. And it's completely covered by your insurance that your employer is providing. That has been a huge joy for me to be able to actually allow that for a patient that's coming on through.
Yeah, that is great because you start to wonder what your insurance is for. And I have that clinic as well, and it's all cash pay. And that question comes up all the time. Well, why doesn't insurance cover it? And I'm like, insurance, if it's going to help you, it's not going to be covered by insurance in some way or another. So in terms of the breast cancer naturopathic therapies, what kind of treatments do you actually recommend for breast cancer patients?
That's great. Yeah. So breast cancer specifically, the first thing is one of the things that I always like to be able to say when it comes to any of the diagnosis of cancer, one, trying to be able to prevent it and early diagnosis is key. Absolutely key. So I want to talk first a little about just the risk factors and things like even obesity and things like this. Again, being able to getting into, again, a normal BMI or at least a BMI under 30.0, which is your obesity BMI, can go a long way to be able to prevent all cancers, but breast cancer included. Okay. So I always like to say, yeah, trying to be able to lose those extra pounds. And there's many ways to be able to do that. And that's great. What we do for even our corporate wellness side from an Envita health standpoint is being able to help support those different methodologies to help lose that weight. You also have, though, things such as just exercising. I always like to say, too, get 10,000 steps in a day. Right? Get 10,000 steps in a day. This ability to be able to just be moving and exercising. If exercise was a drug, it would be the best drug on the market. But oftentimes it's not even prescribed because it's not even being thought about in the actual plan. But this is where sometimes it's a misnomer that you have to go and be some type of marathon runner. Don't even do running, just walk 10,000 steps a day. It's actually healthier for you to do this. So many times people think, it's the new year. I'm going to get back into the gym, and they get in the gym and then they're exhausted and they're tired the next day because their bodies can't recover. Let me just say they're probably hormones are imbalanced anyways from the lack of weight and the metabolic syndrome. So this is where you can't even recover effectively. But when you do that, the other thing that occurs is that your cortisol levels increase because you're almost stressing the body out. And so you increase inflammation and increase cortisol, and then you have fluid retention and fluid weight. And then it's disappointing because I'm going to the gym, I'm working hard, I'm doing all this activity, and I'm not even losing weight because I have all this fluid retention. Don't do that. 10,000 steps a day. Awesome. Get on a rebounder. Being able to just do a trampoline for 10 to 15 minutes goes a long way. Just raising your hands up above your head and doing a rebounder can actually improve your immune system. Again, this is what the data shows, and these are very simple things. So I always like to say, try to prevent it. Now, the other dynamic is early awareness of breast cancer, okay? Early diagnosis, because this is where, for us, again, we can treat these very complex diseases, stage 3, stage 4, when no other options are available, and they come to Envita and we run full genetic biomarkers, and we can actually find, yep, they're actually targets that are available for you and be able to bring you into remission. That's awesome. But it's so much easier and it's just so much better being able to catch it early and doing the right steps when you do catch it early. So breast cancer specifically, one of the things you'll hear this differently from what I recommend than what other individuals recommend. Many people are recommending mammograms out there. Okay, I want to raise some awareness. One, that mammograms can be missed. They can miss the actual breast cancer. It's about 30% of the time, depending upon the actual mammograms that are used. But again, there is false negatives that are going on with breast cancer. A lot of radiologists know this. And so this is where there's a lot of breast cancers where you get a mammogram and it may not be conclusive that it's cancer or not. And so they're kind of staging it to be able to be safe, but then it creates a lot more concern on the patient And then it's more treatment and more high increased cost to the system. And this is where you're left with, again, these further evaluations that actually it doesn't show that it is cancer. Okay, so one of the things that I like to say is that there are other therapies that are out there. One, you want to be able to do screening. Again, breast screening. One of the things I like to be able to recommend too is, just for other examples, is a quantitative ultrasound. Again, I love quantitative ultrasound. That's where most radiologists, when you do an ultrasound, if you've ever seen this, is that it's almost the ultrasound with the probe. Oh, they're giving me the thumbs up. You have the probe of the ultrasound unit that's a single unit, and it creates the sound waves. And then it also is the receiver of the sound waves coming back. It's one in both. If you put that over, it's a very kind of still a fuzzy image. If you've ever seen your ultrasound, even when you go and have a baby and you're doing an ultrasound at the time, it's not the clearest. They've done now 3D ultrasounds as far as that goes, trying to be able to have some computer information that can help with the imaging. But what this is that this is a way to be able to ultrasound the breast. That what it does is it actually has the ultrasound unit, the waves that are being produced are on one end. Then you have the receiver on the other end, and the breast sits in the middle, and it gives clear images. It's beautiful images, very clear and better than many times in a mammogram. You don't have the breast squished. There's all these other things that it's just very uncomfortable. This is a great way to be able to actually have crystal clear images at the same time, very good experience. I love that as far as being able to recommend for my patients because you get very clear images. That's just one of the things. There's other tests out there as well, even like a blood test. There's blood tests now that you can run. And I love these blood tests because, again, they're able to diagnose and see if there's evidence of disease in about 20 to 50 cancers, depending upon the test. And so you can actually do a blood test to be able to actually evaluate. And I love that because, yes, you want some imaging, but you also want to be able to say if there's a blood test that can see if there's a cancer. Now you're starting to be able to look at, instead of just a kind of this one size fits all model with mammograms, that you may have other options available. I'll also say my concern with mammograms is that many times women are starting at 40 years old. This is the recommendation: 40 years old to start with mammograms. And you want to be able to do it yearly. And there's a debate if you do it yearly or every 2 years out there in the actual world of breast cancer health and screening. But I will say that if you're getting it yearly from the starting of the age 40 until you're 65, 70, it's not a matter of if you'll develop cancer, but when you will develop cancer, because radiation is a part of the mammogram experience. So when you get a mammogram, you're exposed to that radiation. And that can be a cause. And many times these actual later cancers in women, later breast cancers, are a result of their fastidious mammogram use. And so this is also where it's just important I still use some mammograms on some certain times, but it really is important that you're not getting it yearly every single year until your old age, because that's actually can be inducing the development of cancer. So I think that's another important to be able to be aware of.
Oh, yeah, that's really important. And I love that you said that because, again, it goes against the algorithm of what we're told. And when you go and you have your 7 minutes with your provider, they have to check off the list all the things that they need to do. You need to have your statin and your aspirin and your mammogram. And it's borderline malpractice, to be honest. All right. So what are some of the biggest challenges integrating naturopathic medicine in this field?
The biggest challenge is, I would say, the general overall insurance, the insurance coverage for this kind of, when you go outside the standard, to be able to have an insurance cover that. And many times, I mean, this is where when I'm doing these interviews, I'm always recommending be an advocate for yourself. Know what the data is, educate yourself, bring those questions up to your doctor so that you can actually have those questions be answered. I like doctors who actually answer the questions as well. I think we can all experience doctors who are a bit, maybe I think they're a bit intimidated by the questions that patients like to ask. You can't have Dr. Google out there. That's a concern to me as well. But at the same time, it's been a really good thing because it's raised awareness about being able to think for yourself. So again, not everything out there on the internet is great, but there's a lot of good access to information, and it's good questions to bring to doctors and be an advocate for yourself. So that's one of the things, is be an advocate for yourself and ask questions to your doctor if they have the time, and keep them there to be able to keep asking those questions. I think that's a great thing. Be an advocate for yourself. The challenge is going to be then, but once you do it, that are you going to be able to actually have a willing doctor to be able to do it for you once you are seeing and you're clear that this is the right thing for you? And then do you have a willing doctor, and is your insurance company going to cover? And if not, then sometimes you do have to be able to actually travel and fly like people do to be able to come out to Scottsdale, Arizona, because again, this is where things are actually, you're getting that kind of technology. I'll give this example. We recently had a patient that came on in to see us. Her husband was a doctor, and she was just recently diagnosed with early onset breast cancer. And this is where you go to these large ivory towers of healthcare facilities. We all can understand. We probably know these healthcare oncology centers across the country. And he goes on in and he's well informed. He's a doctor. He knows and he loves his wife. He wants the best for his wife. He actually did rounds at this facility when he was a medical student and resident back in 30 years ago. And he comes on in because he said, I think things have got to have changed. Can you actually have any additional technology that's around to be able to see, should I just get a lumpectomy and cut it out? Or has there been any other data suggesting that this is something that I should choose things differently? They go, no, we don't offer that. And he goes, well, hold on. I've read something about how there may be a blood test that you can have where you can actually see if cancer cells have come away from that tumor and then spread already into the bloodstream. Can you offer that? They actually said, no, that's new technology. He goes, actually, this paper was around 15 years ago. This has been something that's been around. And they go, well, if there are centers that do it, but we don't do it here. And in a sense, what they're saying is that they're saying, well, it's not in my system, not in the medical insurance complex to be able to do this. If put on your doctor hat, I'm going to recommend the same protocol because I'm in a hospital that only does this protocol. My insurance is only going to cover your insurance that you're coming as a patient is only going to cover this protocol. And what if I actually ran this test and it showed that the chemotherapy that I was going to be recommending was actually not going to be effective for you? So then it's a patient concern. It's a challenge. And I think about this as a doctor. It's like, yeah, if I'm a doctor, you go into medicine to want to heal people, and then you're put into a system where it's like, maybe for the sake of the patient, I don't even want to recommend that because it's going to create a huge amount of concern and anxiety. And then they're going to be placed in a position of, even if you pay cash for the labs, which that's what he asked. He goes, well, can I just pay cash for the labs? He goes, no, I won't do it. You have to go somewhere else because it's not the system. It's a square peg in a round hole. And this is where then he came out and he saw us at Envita. And we had all the conversations and we ran all the tests and we were able to see exactly pinpoint the best treatment for her, that it was based upon the blood, the full imaging and giving a non-invasive procedures, both to be able to clear it on out. She's doing great now. But this is where you want the information and the data to be able to make best decisions. A good tell sign is if you are in a place that is unwilling to be able to get more data or answer questions to be able to make best decisions for your actual care, you may want to start looking elsewhere. And I'll just say that and try to find it because you want somebody that's hearing you out and answering questions authentically, not just hiding behind, again, that this is the protocol or this is what you have to do, or that really, again, especially when it comes to life-saving terminal illnesses, you want to make sure that you're not making an irrational decision. I'll tell you that's not based upon data. One of the things that's really important with breast cancer as well, there is differentiation, like I said, a little bit. When you get the breast cancer in a pathology lab, then differentiating it, they're usually saying, does it have estrogen receptors on it? Does it have progesterone receptors on it? Or does it have a molecule called HER2 positive, which is a growth factor that's on the surface of cells for breast cancer? You want to be able to know that. And that's important. And that's just 3 biomarkers that you can choose to plan from. Again, like I said, Envita's got thousands to be able to see how the cancer is moving, growing, how is it invading, being able to evaluate this, because then you can choose the treatment plans that are specifically targeted for those biomarkers, just like you do with estrogen receptor positive or HER2 positive. But there are many women will have triple negative breast cancer. They don't have estrogen receptor positive, HER2 positive, or progesterone receptor positive. And so they're left with, well, I don't know how to treat this with a precision approach, at least a minimal precision approach. But this type of cancer, what they actually show is that even if you have a very early stage 1, it hasn't moved anywhere. So I will tell you that in the data, women with triple negative breast cancer, even with a stage 1, has a very high likelihood, even if it's removed and they actually do either lumpectomy or mastectomy and remove the complete breast and they think they get it all, there's a very high likelihood that it will actually return, even if you've removed the whole thing in a surgery. Okay. What we see is that with our data, when we actually run those circulating tumor cells in the blood to be able to see, has there been any cells broken off from the actual cancer in the breast, even if it's an early stage, like a stage 1, it shouldn't have gone to the lymph nodes. It should be well contained in the breast, but we see a certain percentage of time that those cells are actually already in the blood. And it goes outside our standard thinking about, well, how we actually diagnose stage 1, because in a stage 1, it should not have had any metastases yet. It shouldn't have broken through that basement membrane, and it should have been well contained. And as long as you actually remove it, it should be gone. You should never see it again. But there's certain cancers that actually it finds a way to those cells to break off and to be able to be in the bloodstream. But this is very consistent with what we see clinically to what patients experience. They get it removed and then they say, well, I've got it removed. And now it's what? A watch and wait. Well, everybody has the celebration and the party to be able to say, congratulations, you're cancer free. I love it. But what if there's data and lab testing, and I'm telling you there is, that you can actually say, I'm not going to just assume that I'm cancer free. I actually want to know with the latest technology that's out there that I actually don't have any circulating tumor cells in my bloodstream. Wouldn't that be nice to know? And if there is, then you want to treat those effectively. Okay, so that's a concept. I will say this too. Talk about different algorithms outside of the algorithms. Everybody usually knows what a carcinogen is. I don't have to usually define it, but I always define it as well. What is a carcinogen? A carcinogen is a chemical toxin in our environment that when inside the body, it has a propensity to cause cancer. Okay. So everybody knows what carcinogens are. Even the state of California is what passed a law to be able to say if a place of business knows that carcinogens are present in the place of business, they have to label that a known carcinogen is possibly present on this. You go to Starbucks in the state of California, you can actually see a disclaimer on the cup. There may be known carcinogens in a Starbucks cup. Again, everybody is aware that carcinogens are in our environment. When is the last oncologist? And I love this question because if I see an oncologist, I have not yet met an oncologist that will evaluate the carcinogens when the actual cancer is diagnosed. So when you actually have a stage 1 breast, wouldn't it be nice to know is that if you have a high exposure to carcinogens, then in that what was likely the root cause of where that actual cancer was developed? Wouldn't it be nice to know if you remove the cancer to be able to actually understand where was my exposure? Where did I come in contact with that? Oh, I'm giving another thumbs up. Yes, you want to know. You want to know where those actual carcinogens are at or what the capacity is. You know, when we have, like, for instance, we see female breast cancer in our clinic that when you have exposure, like you live on a golf course or you are a female golfer, you have a higher risk for breast cancer. And this is where when we run this analysis and we actually see herbicides and pesticides that are carcinogenic herbicides and pesticides, these are, again, things that are going to kill off actual, again, plants and kill off insects that are used on golf courses. We see a higher propensity of herbicides and pesticides that are carcinogenic in our female golfers who have breast cancer or who live on a golf course. We see these in 95th percentile. So it's really important, again, and this is where if this is present, it's not just treating the cause, but let's actually shift up removal of where these carcinogens have maybe come from. There's also, again, oncogenic infections. Okay, I'll give this concept. Again, we know this in the data. This is not just unique to Envita. At Envita, we're utilizing the data and the research from across the country and around the world. We know that there are oncogenic infections. I give this example that many times people know about HPV causing cervical cancer, or Helicobacter pylori is H. pylori is a bacterial infection. It's a spirochete that causes, again, stomach cancer. It also leads to stomach ulcers. So we know about this. We also see that there's, for breast cancer, there's something recently come out, Borrelia burgdorferi or Lyme disease, which is a huge problem in epidemic proportions that goes on in chronic latent Lyme. And we see this, that's where a part of our clinic is focused on chronic disease and autoimmune conditions caused by these diseases or these infections, or we have neurological conditions that are caused by these. Lyme, Borrelia, is actually a known oncogenic infection. It actually is well data to be able to study that it actually is, it causes lymphoma or white blood cell cancers, lymphoma. But we've been looking at this correlation with Lyme causing and be correlative with other cancer types, breast cancer being one of them. There was just a recent published study that came on out saying that, again, that confirmed our years of correlations of seeing this internal data to be able to say this was a published study that we just produced that breast cancer has a likelihood that Borrelia burgdorferi is a cause of breast cancer. So this is where, too, when you actually are looking at these causes, really important to be able to, one, remove the cancer. We want to treat the cancer with the best, least invasive, and the best way to be able to treat the cancer and protect against any, making sure that we've identified circulating tumor cells. But we've got to look at, I think it's a really important thing to look at these root causes, because now it's going to be impactful. Most people, when they have cancer, are at a decision point to say, I need to do something different. Because if I keep doing this, I don't want to end up in the same place. I want to make sure that I'm living longitudinally. And it's just a symptom, a side effect and a symptom of something going wrong in the body that needs to be done to be able to improve it. So yes, there's a lot of counseling on diet, lifestyle, specifically for you, but let's remove those actual carcinogens or those oncogenic infections, those cancer-causing infections that if they let go untreated, maybe you show up with another breast cancer in the other breast or in the same breast, but again, in a different location. Let's actually make sure that we clear out those infections that were the reason why it developed in the first place. Does that make sense?
It makes a lot of sense. And you're really speaking the language for especially women who are just diagnosed with breast cancer and they're just stepping into this arena and just going down that path. Do you guys see mostly people that have been through conventional chemotherapy, or are you getting them now? Because I feel like after 2020, people are really researching stuff. They're not just taking the options that are handed to them anymore.
That's been the blessing. One of the blessings, again, 2020, the blessing is that people have really started to be able to be an advocate for themselves and looking at some of the data and asking good questions. So one of the things, again, we have always seen people from either early diagnosis to late stage diagnosis, or have gone through all of the actual conventional treatment programs and then eventually come out to be able to say, I need to be able to have a better option because now I'm being referred to hospice, but I'm still young. I want to be able to fight. I still think that there's still other options available. And the unfortunate thing is, so we've seen all kinds, and we do see all kinds at Envita. Obviously, I would say it's so much easier to be able to treat an early stage patient and give you the kind of the recommendations because an ounce of prevention is worth a pound of cure. And it's just a lot easier to be able to have information and be able to have knowledge before you go through this process and then finally learn. But don't go through those high dose chemotherapy because, again, if you have a later stage disease, do you know that chemotherapy causes cancer in the future? It is actually a carcinogen. So I want to utilize it, but then I want to be able to clear it out of the system. My patients always hear me say chemo in, chemo out. Let it do the job that we've designed and we want it to be able to do, but then remove it from the body so that it doesn't linger and cause more side effects and, heaven forbid, a new cancer in the future. So there's ways to be able to actually help clear it out of the actual system. So this is where there's all kinds. I would say, though, that for the most part, people do still have this paradigm in their mind, even after 2020. It's, I want to use my insurance because it's like, man, it is getting expensive year over year. You're seeing this, even employers, they're getting 20 to 30% increases in their premiums year over year. And it's like, what am I paying for? Why am I actually having all of this payment going out? And what am I actually getting for it? So people, they do want to use the insurance that they've been paying an arm and a leg for. I say, go to Envita Health, look at the actual options that we have to be able to see how we can be strategists with your employer to be able to provide these options. But I will say this is that when it comes to that whole dynamic of people still want to say and hope that it's like, okay, I'm going to still do this and still hope that this is the best thing for me. And so we still see a lot of those. And even when we still have people that are using their insurance and trying to go to some of these other standard of care models that will still even see you at that point when you've failed everything, and we'll still see you. And oftentimes we can actually find targets that you were never offered. I had this gentleman, and we have it with, I had it with breast cancer as well. Literally, again, you see these cases. We actually have a lot of case studies up on our website so you can see Dr. Prado and I, we review these case studies, we look through them, giving examples of these cases, breast cancer and lung cancer and all these diseases that have huge amounts of tumor burden on them. And they've tried everything and they've done everything. And there's even patients that they're referred to hospice. I got nothing left for you. And they still come on out and they say, I think I need another option. And when you let the data decide, let the data run and say, are there still options that are available to be able to treat your disease? And then being able to run the data, getting the data, and then being able to develop a plan with an Envita physician, it's life-giving. And when that happens, I'm always celebrating it. I just recently talked to my doc last week talking about a cancer case that was coming in. I was really concerned about her. Even just 3 months ago, coming on in, cancer littered everywhere amongst her body. She actually had brain mets and was a severe brain metastases that the cancer had originated in the body and then metastasized to the brain. It was all over 13 weeks. And she's close to complete and full remission. It's just beautiful. And those are the kind of cases we do bell ringing ceremonies at Envita. I love it because patients don't have to, but they're able to. That's our why. When you see the patient actually being healed, and this is where we plug that out to all of our employees. So you have pharmacy techs that are in the back, waking up at 4:30 in the morning, making these medications. They know what their purpose is, that it's going to go to eventually a patient, but sometimes can become a bit disconnected with the human aspect. And so we post these bell ringing ceremonies where the patients can say anything they want. We've had some people recite poetry or just saying thank you and ring the bell. But again, when you see these cases, it's just beautiful because that's the why, that's the motivation. If we're not doing it for that, again, why are we doing it? I will tell you, oncology and the way we do oncology, that's not the easiest, but it's worthwhile. It's beautiful. And being able to make sure that we're doing the right by people is just such a gift. And when you actually have those results, I know for us, we celebrate it. My doctors that I work with, there's a real dynamic in doctor circles as well. Physician burnout. Again, physician burnout's a real thing. There's so many docs they just get disgruntled. They go into medicine to try to help people, and yet you're in this system of gridlock. And you're like, I got to do it in this way. We don't deal with physician burnout. We love it. And we're dealing with oncology patients that their lives are being threatened, and we don't deal with it because we love it. We actually see outcomes and results, and we're actually working together and having this great culture that's formed. And we see patients that are grateful because they actually have chosen this method and they've gone through and their lives have been saved as a result of it. So yeah, it's a great gift and a great honor to be a part of this team.
Yeah. And I mean, your passion comes through just incredibly. So we can see that and it's awesome. So to kind of round up this conversation, what is like on the horizon, especially for the Envita centers? Like what's going to be new in oncology that you're really excited about?
It's great. One of the things that I'm really looking forward to is specifically continuing to grow. So we have a really good immunotherapy program, and our immunotherapy programs are really tailored around the actual patient. But there's dynamics of continually increasing the data that we're receiving to be able to not just say what are specific targets, and this goes a little off the deep end, but the spatial relationship of immune cells and cancer cells and where these immune cells are at amongst the cancer actually plays a role. And so if you have certain percentages of immune cells again, the immune system is so complex, and essentially where you're at is that you have cancer cell or immune cells that are going to kill cancer cells. You have immune cells that are going to help to protect the immune system from attacking itself. And so being able to have spatial analysis of this work to be able to actually evaluate, we're doing a lot of research and development on this right now to be able to actually look at how we can actually improve the outcomes. It's always one of these, yes, it's great that we get good results, but also why is it that not every single person responds to the actual care? And that's really where, even though we're having really good results and it's beautiful to be able to have that, continue to implement the latest technology to say, I'm not satisfied until every patient is getting the kind of care where you're getting a home run every single time. I want every patient to be able to be in a point where in 13 weeks, you have a high level of disease and you're getting complete full remission as a result of that. And so this is where for us, and then what's also, I think, a really important thing is the preventative and the early stages, because there's so much opportunity. I would even say if you're in remission, come, call, let us see. Because I will tell you that, again, get analysis. Because this watch and wait approach, you've got a mammogram, you got the lumpectomy. Now you're all excited that you're in remission. Are you? really important to be able to say, where did it come from? We can do that and be able to say, listen, I think there's an option for you. Let's make sure that you're actually there. So the more we can educate and get that, and then the insurance coverage, being able to have employer groups nationwide to be able to actually insure patients and make sure that you're doing it either through a telehealth model, through corporate wellness that we offer at Envita Health. We call it Biomed and Biolytics. And this is where you can find it at Envita Health. That's exciting because the more people know about it, again, we want to change the parameters to be able to say there's different options that are available, because right now, the old system that's currently in place, you're paying an arm and a leg for it, and it's expensive, and the outcomes are poor. And this is where the dynamic of, wow, all right, Envita Health, I just had, balloons show up. I don't know what's going on with my AI or with the service that we're using. I don't know if you're seeing it here as well.
I have. It's hilarious.
It's unbelievable, but I got to stop using my hands. But it is, I think I don't want it to just be an option for a few and for a good amount of people that can afford this. I want it to be an option because the dollars are there for everybody. It is so good. And if your insurance company was able to cover this, again, which it is for employer groups that we're working with, we'll just want to see that continue to be able to improve because it's life-saving and becomes an amazing option for people to be able to have access to.
Love it. So where should people go if they want to learn more, find out about what you guys do? Where can they go?
Our website has a lot of great resources and a lot of testimonials, a lot of information. And so you can start there to be able to, if you want to learn more about the medical center and the center of excellence, go to envita.com and envita.com. If you want to learn more about the programs, as far as our strategists go, as far as corporations and employer health and employer-sponsored healthcare, you can go to envitahealth.com.
Awesome. Well, thank you so much, Dr. Oertle, for sharing all this with us. This was amazing.
You're welcome. Happy to be here with you today, Catie.
Beyond the Medical Algorithm is brought to you by the Philly Wellness Center. To find out more about the Philly Wellness Center and how we're challenging conventional medical wisdom and shedding light on more natural means of healing and therapy, visit phillywellnesscenter.com. And then make sure to search for Holistic Health in Apple Podcast, Spotify, and Google Podcast, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at the Philly Wellness Center, keep celebrating the innate power in our incredible bodies, and thanks for listening.